Are you ignoring these 10 warning signs of cancer? Cancer can be a daunting disease. But fear not, because HealthVerse has got your back. We've put together a fantastic video to help you spot the warning signs of cancer that you simply cannot ignore. From persistent coughs to tummy troubles, we'll show you what to look out for and when to seek medical help. So sit back, grab yourself a cup of coffee, and get ready to learn the top 10 unmistakable clues that could indicate cancer. Trust us, you won't want to miss out on this essential knowledge. 1. Unexplained weight loss. When healthy cells are attacked by cancer cells, your body may react by losing weight. Did you know that losing 10 pounds or more without any explanation could be a sign of cancer? According to the American Cancer Society, ACS, many people experience unexplained weight loss before being diagnosed with cancer. In fact, this could be a telltale sign of cancer. So pay attention to your body and don't ignore any significant weight loss. It could be your body's way of telling you something important. Unexplained weight loss can be caused by various medical conditions, like hyperthyroidism. But if you experience a sudden and significant drop in weight, it could potentially be linked to cancer. Specifically, cancers affecting the lungs, esophagus, stomach, and pancreas have been known to cause this type of weight loss. But don't let this information scare you. Being aware of the potential warning signs of cancer can help you catch it early and get the treatment you need. So, if you're experiencing significant weight loss without any explanation, it's best to talk to your doctor and get it checked out. 2. Unusual bleeding or discharge. Tumors and other unusual growths can cause abnormal bleeding or discharge from various parts of your body, which could potentially be signs of cancer. But don't panic just yet. The type and location of the bleeding or discharge can give important clues about what type of cancer might be causing it. For example, bloody stools could be a sign of colon or rectal cancer, whereas blood in the urine could indicate bladder or prostate cancer. Any abnormal vaginal bleeding or discharge should be investigated for the possibility of gynecological cancers, such as endometrial or cervical cancer. Advanced stage tumors that have spread to other parts of the body may also cause bleeding or discharge. Abnormal gastrointestinal bleeding or a buildup of abdominal fluid may be signs that cancer cells have spread to the liver. Stomach cancer may cause less obvious bleeding since the malignancy itself causes internal bleeding. It is crucial to remember that not all instances of unusual bleeding or discharge are brought on by cancer. Other benign conditions can also cause these symptoms. 3. Fever. While a high temperature is not often thought of as a major symptom of cancer, it can be a secondary symptom brought on by the body's immunological response to the disease. When the body detects an infection or inflammation, it elevates its temperature to better combat the pathogen. Inflammation caused by the body's immunological response to cancer cells can sometimes result in a fever. It is often an indicator of cancer's advanced stage, or metastasis, which essentially means that the cancer cells have spread from the place where they first formed to other parts of the body. Persistent fever could be a warning sign of blood cancers, like leukemia and lymphoma, which is why it's crucial to take note of any unexplained fever and seek medical attention to identify its underlying cause. While fever may not always be a sign of cancer, it's essential to be aware of this symptom and not ignore it if it persists. Getting an accurate diagnosis and starting treatment as soon as possible can improve your chances of recovery. Don't hesitate to talk to your doctor if you have any concerns about persistent fever that just refuses to go away. 4. Persistent pain and fatigue. Pain and exhaustion that won't go away are hallmarks of cancer and have multiple potential causes. Cancer cells can develop and invade surrounding tissues, producing pain and suffering in the affected location. Moreover, cancer cells can create compounds that might induce inflammation and further add to the pain. Cancer patients often report feeling weary and weak due to the fact that cancer cells absorb a lot of energy from the body's cells. According to the American Cancer Society, fatigue is more common in patients with leukemia. Fatigue can also be due to blood loss from other malignancies. The pain of metastasized cancer is a reality for some people. For example, back discomfort may be present in malignancies of the prostate, colon, ovaries, and rectum. Additionally, cancer can induce changes in the body's metabolism and hormones, which can also contribute to sensations of discomfort and exhaustion. While these symptoms can also be caused by other conditions, it's important to pay attention to their duration and severity. If you're experiencing persistent pain or fatigue that is not relieved by rest or medication, it's essential to consult with your doctor to identify any underlying causes and determine the appropriate course of action. 5. Persistent cough or hoarseness. One's cough could be the result of a variety of different factors. This is the body's natural mechanism for removing toxins and other waste products that aren't needed. A cough may be caused by dry air, allergies, the flu, or even a common cold. If you've been dealing with a persistent cough that just won't quit, it's essential to take note of the other symptoms that may accompany it. For example, when it comes to lung cancer, a lingering cough can persist despite attempts at treatment, and may even cause hoarseness or the coughing up of blood. But lung cancer isn't the only culprit. A cough that doesn't seem to go away can also be a symptom of thyroid cancer. So it's crucial to be vigilant and consult with your healthcare provider to ensure that you receive an accurate diagnosis and timely treatment. Remember, early detection is key to a successful recovery. 6. Changes in digestion. Cancer, and especially tumors of the digestive system, including the liver, stomach, pancreas, colon, and rectum, can cause digestive changes. It is possible for a tumor to clog the digestive tract, resulting in abdominal discomfort, bloating, vomiting, nausea, constipation, and diarrhea. Pancreatic cancer has been linked to alterations in digestive enzyme synthesis, resulting in impaired digestion and a loss of body fat. Head and neck cancers and esophageal cancers are two of the main diseases that have been associated with swallowing difficulties. In addition, some tumors might cause gastrointestinal symptoms, like loss of appetite or pain after eating. On the other hand, these signs and symptoms are not unique to malignancies of the gastrointestinal system. Ovarian cancer has also been linked to persistent fullness or bloating. When caused by cancer of the brain, nausea and vomiting are also common side effects. It's important to keep in mind that these symptoms can also be caused by other common illnesses, such as gastroenteritis or IBS, irritable bowel syndrome. Now, it's completely normal to experience occasional digestive issues. But if you notice persistent changes in your bowel habits, such as prolonged diarrhea or constipation, it's important to seek medical advice. 7. Changes in skin moles. Changes in the skin, such as those seen in moles or warts, are strongly associated with the development of skin cancer. Certain alterations in the skin's appearance may also be indicative of other types of cancer. White patches inside the mouth, for instance, may be a sign of oral cancer, whereas tumors, which can appear as bumps or lumps under the skin, can develop in a variety of conditions, including breast cancer. Alterations to the skin caused by cancer can include symptoms such as increased hair growth, hyperpigmentation, dark patches, redness, jaundice, or yellow skin and eyes. Changes in the skin caused by skin cancer can also involve sores that either do not heal or heal but then recur. These sores can either be temporary or permanent. 8. Night sweats. Nocturnal sweats are far more extreme than ordinary perspiration or heat sensitivity. They usually leave you drenched in sweat. Night sweats, like the other symptoms mentioned, can have many different causes, such as the flu or bacterial infections. But they have also been found to be related to the early stages of leukemia, lymphoma, and liver cancer. An overproduction of cytokines, which can lead to fever and night sweats, is a potential side effect of these tumors. If you experience night sweats regularly and they are accompanied by other symptoms, such as fever, fatigue, or unexplained weight loss, it's important to consult with your doctor to determine the underlying cause. 9. Persistent lumps or swelling. Lumps and bumps on the body can be an indication of cancer, such as breast cancer or testicular cancer. But they can also be caused by benign conditions, such as cysts or lipomas. Lipomas are benign, non-cancerous lumps that form under the skin. They are made up of fat cells and are usually painless. Despite how scary they may look, they're completely harmless. However, if you notice a new lump or bump on your body, or if an existing one changes in size, shape, or texture, it's important to have it evaluated by a doctor as soon as possible. They can perform tests, such as imaging or a biopsy, to determine the underlying cause. 10. Shortness of breath. Have you ever found yourself gasping for air, struggling to take even the slightest breath? While it may be a sign of a respiratory infection or anxiety, it could also be a symptom of cancer. When cancer cells invade the lungs or spread to other organs, they can cause inflammation, obstructions, or narrow the airways, making breathing a challenge. It's not just lung cancer that can affect your ability to breathe. Other cancers, such as leukemia and lymphoma, can also lead to shortness of breath. Although shortness of breath can be caused by various conditions, it's always wise to get it checked out by a medical professional, especially if you have a history of cancer or other risk factors. Don't ignore the warning signs. Catch them early and breathe easy. And there you have it, guys. The 10 warning signs of cancer you should watch out for. But here's the thing. Just because you have one of these symptoms doesn't necessarily mean you have cancer. That being said, it's always better to be safe than sorry. That's why we highly recommend consulting with your doctor just to be sure. Have you or someone you know experienced any of these warning signs? What steps did you take? Share your story with us in the comments below. Like always, we'd love to hear from you.